And Ms. Fox, he's your witness.
Thank you. Can you please state your full name for the record?
Nicolas Appleton.
How are you currently employed?
I'm a diagnostic radiologist with Tennessee Interventional and Imaging Associates.
If you pull the microphone up about 6 inches, you won't have to bend like that.
Thank you.
You're welcome. How long have you had that position?
This is my 4th year.
And how long have you been in the field of radiology?
I graduated from residency in 2017.
Can you tell the ladies and gentlemen of the jury the education that makes you qualified to be the radiologist that you are?
So I went to medical school at the University of Tennessee in Memphis. Graduated from there in 2012, and I did a diagnostic radiology residency with the Air Force in San Antonio. Graduated in.
How long was your residency?
It's 5 years, and that includes a 1-year internship that's not specific to radiology, but more of a general medicine education.
And then after the residency, was your residency itself focused on radiology though?
Correct.
And then after that, I guess 4 years that you spent focusing on radiology exclusively, and then 1 year doing general?
So that was the residency. So after residency, I was a staff radiologist for the Air Force for 4 years.
Okay. And then, are you certified to practice radiology in any states?
Yes.
What states are you certified for?
Tennessee, North Carolina, Georgia. I've had several medical licenses. Some of them may have expired. So
Those for sure.
those for sure. Yes, ma'am.
And in addition to practicing in different states, are you a member of any professional organizations?
That's a great question. I guess I'm a member of the American Board of Radiology. Or am I just board certified? I think I'm just board certified through them, not necessarily a member.
Do you subscribe to any professional journals?
I'm a member of RSNA, Radiology Society of North America, and
I know you won't have an exact number, nobody
Sure.
ever does, but approximately how many x-rays, scans, and surveys have you read over the course of your career?
oh, Lord, thousands, tens of thousands.
Your Honor, at this point in time, the state would tender Dr. Appleton as an expert in the field of radiology.
Mr. Hood. Ms. Bernard.
And as it is for radiology and not pediatric radiology specifically, then we have no objection, Your Honor.
Then he'll be admitted for that purpose, Ms. Fox.
I'm going to call your attention to November the 18th of 2021 and ask where you worked at that time.
I was working at Erlanger Children's Hospital.
And were you the radiologist that read the x-rays that were associated with the November 18th, 21 examination of Jamison Timms?
Yes, ma'am.
Were there any findings?
No, ma'am. It appeared to be a normal exam.
Specifically as to the ribs, did you view any breaks in the ribs at all? Any healing fractures, any calluses, anything that would indicate the ribs had been broken?
No, ma'am.
Specifically as to his spine, did you know any compression fractures in his spine?
No, ma'am.
Typically, if a bone is fractured, how long would it take before you would expect to see some callusing? And I guess I should explain it, but some bone growth around the break is how you identify a break?
Yes, a non-displaced fracture can be tough to see on an X-ray. And so one of the things we look for are healing changes, and one of those healing changes is a callus formation. It's kind of think of it as like a scab around the bone.
Okay. And how long would it take before you would expect to see a callus forming around a non-displaced break?
Typically 10 to 14 days.
Did you see any calluses on any of Jamison's bones?
No, ma'am.
Specifically as to his ribs, did you see any calluses on his ribs?
No, ma'am.
Did you see any evidence of metabolic bone disease?
No, ma'am.
Did you see any evidence of a vitamin D deficiency?
No, ma'am.
Did you see any evidence of osteogenesis imperfecta?
No, ma'am.
Were the x-rays that you read that were associated with the November 18th, 2021 E1 examination consistent or inconsistent with the normal exam?
Those x-rays were consistent with a normal exam.
Okay. Your Honor, at this point in time, I would like to tender the remainder of the images that were taken off of the Erlanger disc. As I indicated before, the Erlanger disc has been tendered and accepted as State's Exhibit number 5. I've shown these images to the defense yesterday, and I've marked them 5A through P. And for the benefit of the court reporter in the court and all those present in the courtroom, as to the 18th, it's a single digit. The second one is double digits. It's the
Okay.
second one on that disc. So the December one is 2 digits.
Okay, so let me be sure for purposes of the record. The previous witness testified concerning exhibits 5AA through double P.
Because it was the second set of scans on the disc, so there's 2 letters
Right.
for each one.
So this witness will be testifying as to the scans that you've marked as 5A through 5P. Is that correct?
That's correct. And I would tender those scans at this time.
Mr. Hood, any objection? No objection. Ms. Bernard? No objection. They'll be admitted, Ms. Fox.
Thank you. Your witness.
Mr. Hood?
Good morning, Doctor. How are you?
Good morning, sir. I'm doing well. How are you?
Wonderful, thank you. You received, and I guess let me sort of walk through the process with you a little bit. You work with a private entity as is common, and essentially y'all had privileges at Erlanger Hospital, is that correct?
That's correct.
And so you would work a schedule, so many days on, so many days off, or weekends, or so many days a week? Is that how it worked? Or you would be on call certain days, or?
It's mostly a normal schedule, Monday through Friday, first shift, 8 to 5 or 7 to 4 or whatever. Sometimes we cover weekends. In that event, we get a couple days off the next week. I take call, so I will be, on call for some emergent procedures
Okay.
occasionally.
And y'all are always busy. You're not sitting at your desk with your feet propped up waiting to get a call from another doctor to look at images, right?
That's correct. We got plenty to do.
Got an assembly line of orders coming in, stuff to look at, correct?
There's generally something to look at.
Okay. And so in this particular case, you received an order, or I would call it an order, but a request to review some images from a Dr. Garcia. Is that correct?
So the patient comes to the ER, they get evaluated by doc. Doc orders x-rays, they come down to the department, the x-rays get done, and then they go to our computer system immediately, at which point we're able to access them. They pop up on our list and we click on the most emergent ones first.
Right. So you kind of,
So I don't necessarily talk to Dr. Garcia before.
but you're aware of who is requesting you to review images, is that correct?
The name will pop up on the screen, but it's, up in the top right-hand corner. I don't typically look at the name of who's ordering the study.
Okay. Were you aware that Dr. Garcia is the one who ordered the review of these images?
Not at the time.
Are you aware of that now?
I guess so.
Okay. And you looked at these images. Do you know, did you have anything or information about the age of the patient that you were reviewing?
That also pops up on the screen, and you can generally tell, to a certain extent, just looking at the bones.
Okay. And this was a young infant. Is that correct?
I believe so. I don't recall the age off the top of my head. If you say so, I believe you.
Okay. And you indicated that in your testimony to Ms. Fox, what are some of the challenges in terms of reviewing images of children that age? When I say that age, I mean a month to 2 months old.
In regards to what are some of the challenges of just looking at x-rays? Or I know you said children of that age, but it's not. Radiology is broad and deep, and pediatric radiology has a vast array of disease processes. That is a challenge. Looking at x-rays of bones, it's generally, just specifically speaking of fractures, it's generally easy to see if a bone is broken or not, unless it is non-displaced. So think of a non-displaced fracture like this, a displaced fracture like this. I can see this a lot easier than I can see this.
So
If the bones are demineralized for some reason, that makes it a little harder.
Okay. So just so that everybody's clear about terminology, you indicated that this is a displaced fracture, which means that the bone in question has separated.
That's correct. The two fractured ends of the bones have separated. That's a little bit easier to see than when they are butted up against each other in the normal position.
Okay. Non-displaced fracture would be, and this is my definition, don't let me put these words in your mouth if they're not accurate. But a non-displaced fracture would be a crack within a bone that has remained in a stable position. Is that
That's correct.
All right. So a non-displaced fracture of a posterior rib fracture of an infant child, would that be easy to see or difficult to see?
That would be difficult to see. And for that reason, we get follow-up radiographs 10 to 14 days later to look for those healing changes, that callus formation that she mentioned earlier.
Okay. And your understanding, your testimony is that you would expect to see that callus formation in an infant child, in this case, within 10 to 14 days of injury.
Correct.
Is it possible that you would not see callus formation with an infant child within 10 to 14 days of injury?
Probably not within a normal child.
Okay. And when you say normal child, what do you mean by that?
I mean, not malnourished, not deficient in vitamin D or.
Okay. And do you have any information as to Jamison Timms, the child who was the subject of this review, of your review of these images, as to whether or not Jamison was malnourished?
I don't have any specific information. Like I said, the x-rays looked normal, typically with, sometimes on x-ray, if a patient is extremely thin, we use the term cachectic, where you can just see bones poking out. You can kind of see the shadow of those soft tissues around the bones. I didn't see anything like that. The bones themselves were normal appearing.
Okay. And you would then have had no information at the time you looked at these images as to whether or not he was vitamin D deficient?
I have access to the medical record. I don't necessarily open it on all the patients. I didn't see anything in the bones that would indicate to me that he was vitamin D deficient. You do see changes in the bones.
Would there be any radiological evidence? And I'm not talking about full-blown rickets.
Sure.
I'm talking about a vitamin D deficiency or some sort of opaque mineralization problem. Would there necessarily be radiological evidence of that you could see on an X-ray image?
I think if someone is malnourished enough and vitamin D deficient enough for it to affect the integrity of the bones, the structural integrity, you should see something, even if it's just demineralization of the bones. Now that can be subtle. I didn't see that.
Okay. If a pediatric radiologist has offered testimony in this court that he would not necessarily expect to see any radiological evidence of that on an X-ray, would that surprise you?
It would not.
Okay. You had no access to any information about, do you know whether or not this particular child was born full term or preterm?
Not at the moment.
Do you recall having that information at your disposal when you reviewed these images?
I don't recall looking at, again, when was the study read?
Oh, we're past 3 years ago.
3 years ago, okay. I have, like I said, I have access to the medical record. If it's an ER patient, depending on the acuity of what's going on, that information may not be in the medical record. I don't remember specifically looking at this medical record.
Okay. And I'll presume then that you had no access or information regarding the health of the mother during her pregnancy?
No, sir.
No access to information or no information at your disposal relating to the overall health of the child in October of 2021 when this child was born?
No, sir.
Okay. All right, thank you, sir. That's all I have for you.
All right.
Ms. Bernard?
Thank you, Your Honor. Good morning, Dr. Appleton.
Good morning, ma'am.
Okay. So I think I'm looking at the right report that you made, and it's on November 18th, 2021, and it's fairly short. Is that right?
It's pretty short, yes, ma'am.
So it's basically you've got a paragraph saying that an X-ray bone survey was complete and that it had AP and lateral radiographs of the skull, chest, and spine.
Yes,
Does that sound right?
that sounds right.
And then bilateral oblique radiographs of the ribs and multiple views of the upper and lower extremities, right?
That's correct.
Okay. Comparison, none. You didn't have any other scans to look at, right?
That's correct.
And then history, multiple extremity and torso bruises, right?
Sounds right.
And then your findings, no discrete, acute, healing, or remote fracture. The image superficial soft tissues are grossly normal. Lungs are clear. Non-obstructive bowel gas pattern.
Correct.
Is that like you could see gas, but it was non-obstructive?
Yeah, so when you have a bowel obstruction, things start to back up, the bowel becomes dilated. You can sometimes see that on X-ray.
And were you able, so you were able to see some gas buildup here?
Nothing abnormal.
Okay,
So you have normal gas in your bowel.
okay. So is that something that you can tell anything about colic from, or?
Colic is kind of a tricky word. It's more of a colloquialism almost. Folks get diagnosed with colic. It's just belly pain in a child. Lots of things cause belly pain in a child. Most commonly constipation. You could say gallbladder disease causing colic to somebody.
Okay. And then, and you said no radiographic evidence of trauma in your report, right?
That's correct.
Okay. And so would radiographic evidence of trauma be, bleeding building up in the skull, or what would be radiographic evidence of trauma, I guess is my question.
Fracture's a big one. That's a big one we're looking for. I'm sorry, y'all, the trees are blooming. Like I said, fracture's a big one. Soft tissue swelling, you see it a lot with skull injuries. They'll may have a skull fracture and they'll have a bunch of soft tissue swelling around the fracture. You can see injuries to the lungs, like there is something called pneumothorax. That's where you essentially pop your lung and the lung deflates and your chest cavity fills with air. It can also fill with blood. In the setting of a hemothorax, hemo meaning blood. What else are we talking about? X-rays for trauma. Calcifications, abdominal calcifications. So if you get a big abdominal hematoma, then that will calcify over time, indicating a more remote injury.
Okay. And so if I understand you correctly, not trying to put words in your mouth,
I appreciate that.
that if there had been some sort of physical trauma associated with the multiple extremity and torso bruises that you had been advised of, that you would have been able to see some of that soft tissue swelling and blood collection?
So I can't necessarily see, again, there's gradations of hematoma. I've got, I ran into the wall yesterday or something, and I got a little bruise on my shoulder. That's technically a hematoma. My mom fell off a horse several years ago and had to have surgery for this massive hematoma in her leg. There's gradations. I'm not going to see this small hematoma from running into the door, I will probably see some soft tissue swelling from a big one.
Okay, so my sister also got a hematoma from a horse accident as well, so I know those can be very, very painful and traumatic. But so in an infant, if there had been a lot of force causing extremity and torso bruising, is it reasonable to think you would have picked something up as radiographic evidence of that trauma?
Not necessarily.
Not necessarily.
Not necessarily. I mean, if there's obvious deformity, like I said, with these, skull fracture comes to mind just most easily because you've got thin, soft tissue against hard bone. So if that soft tissue starts to swell, it can't swell this way into my skull. It has to swell out. And so if I get trauma to my belly, it will swell out a little bit and it will swell in a little bit, and you may not see it as much on just a plain x-ray.
Okay. Well, but did you see any of that at all
No,
on
ma'am.
this x-ray?
No, ma'am.
So nothing whatsoever to suggest that there was trauma to this child?
That's correct.
Okay. Did you have any follow-ups with any other doctors or radiologists on this case after November 18th of 2021?
I know just from getting ready for this that Dr. Coleman read the follow-up bone survey that this child had done, and it looked like he called it normal, from what I could see.
Okay. And so that was in the past couple of weeks preparing for this trial was when you became aware of that, or was that a comparison that y'all did back in 2021?
It was a comparison from 2021 that he read. So patient came in, I read the first studies, and per our protocol, 10 to 14 days later, we got follow-up radiographs. I say our protocol, I want to say it's Dr. Garcia is our specialist that manages these cases, and she will typically be the one ordering those follow-up x-rays.
Okay. Well, I suppose then my question, did you and Dr. Coleman or Dr. Dixon or anybody at CHOA, did y'all ever discuss your radiologic findings with regards to Jamison Thames?
No, ma'am.
Okay. So were there any conversations you had with any other doctors, medical professionals, social workers, anyone relating to Jamison Thames, or did you read the scan and then come talk to the district attorneys about it?
They came and talked to me.
They came and talked to
That
you?
was about the extent of my involvement prior to hearing from them.
Okay, so this report is what we've got. There was never any further conversation with anybody else about trying to figure out what's going on with Jamison Thames?
As far as I recall.
Okay, thank you so much. I don't have any other questions for you, Doctor.